Hi, for those who don't know me, my name is Dr. Harry, and today we'll be talking about a common infection called hands, foot, and mouth disease. Let's abbreviate it HFMD. We're going to be covering a few things today, like the symptoms, how is it diagnosed, how do we treat it, or how do we manage it, and how do we prevent it. So, hand, foot, and mouth is a contagious illness usually seen in young children. It's characterized by fevers, having sores in the throat. Also, because of those sores in the throat, of course, they're going to have loss of appetite, right? Also, they would have rashes and or small blisters on the hands and the feet. Sometimes they could have it on the buttocks or on the legs. So this is caused by direct or indirect contact with bodily fluids, like when the person sneezes, when they cough, by stool, or in contaminated sources or objects. HFMD is usually contagious within the first week of the illness. Incubation period is basically when the infectious start to where you actually start having any symptoms, and that is usually 3 to 5 days. This disease, it usually has a clinical diagnosis where the healthcare profession or the doctor would notice that they have these rashes, they have these blisters or these sores in their throat, and then that's when they would diagnose it. It doesn't usually need any other tests to diagnose this. That is why it's called a clinical diagnosis. So in terms of treatment, there's no specific treatment. The infection or the illness usually resolves on its own within 7 to 10 days. What we need to do is encourage the children to drink, eat, keep hydrated. Most of the treatments is supportive. It's important for you to keep the fever down, so giving them like simple paracetamol or even ibuprofen will help. So one of the main complications that we do need to consider is dehydration. If they are refusing to eat or to drink, they're looking lethargic, like logy, changing their activity, then it is important for you to bring them to the hospital as soon as possible. Antibiotic nor antiviral are not recommended in hand, foot, and mouth disease. Now, how do we prevent hand, foot, and mouth disease? I'm pretty sure by now it's a giveaway to teach your children how to wash their hands with water and soap. Also, teach them how to sneeze and cough inside of a disposable napkin and to dispose of that napkin right away. It's important to use hand sanitizers in places where you don't have access of water and soap. And also importantly, not sharing towels or household items with anyone else. Once a child is feeling better, it's safe to say that they can return back to school. No need for them to wait until when all the blisters are cleared up. So I hope you found this video very useful and informative. You can let me know down below which medical topic you'd like me to speak on next. See you guys next time.